Can you describe a little bit about the history of nurse practitioners at Codman Square Health Center?
Sure. We've had nurse practitioners at the health center for well over 25 years. Nurse practitioners are a great source of support for our patients. They come from a different perspective than physicians. They come from the nursing. It's a caring. It's a patient-centered perspective, and that's consistent with another broad element of primary care and family medicine. But I think it's important to recognize that nurse practitioners bring something special to primary care and to Codman Square Health Center. You mentioned about teaching. So we've had a long history of excellence in teaching at Codman Square Health Center. Began over 30 years ago with residency, residents from internal medicine. And then for over 3 years, we've been one of the sites for Boston Medical Center family medicine residency programs. But we've done lots of teaching in family medicine for residents, medical students, nursing students, nurse practitioner students for a long time, PA students, and medical assistants. So it's sort of the fabric of what we do. We tend to have people who are generative and want to share their knowledge, especially with people who are interested in acquiring that, and that's new graduates from any program, nurse practitioner, PA, and medical programs.
Which makes Codman a really fertile ground for teaching. How did Codman decide to move towards the nurse practitioner residency?
Yeah, so really important. So one is we recognize that this is the workforce of the future. And we want that workforce to be set up for success. Because of our experience over the years, we know that nurse practitioner programs prepare nurse practitioners to begin a practice. And what we recognize is that there's some deeper, further, and local as well kinds of knowledge about practice that we wanted to help nurse practitioners ramp up quickly and efficiently. So over the years, it would be something that we would do as an informal program with a new grad coming in who recognize what they need to become more familiar with, whether it's in medicine or programs or facilitating or adding on urgent care or adding on specialties, whatever. So with that, we felt like here's an opportunity. Let's codify what the kinds of things we're doing, but let's get some information from the outside. Let's get support from people who've been doing it for a while. And we developed our program really based on that, but we had that internal sort of sense of what it is that what we wanted to do. Some other important elements. So we also think it's very important to understand our community. And there are many, many people in our community who are nurse practitioners and represent the community racially, ethnically, linguistically, and that's a connection with patients that you can't get otherwise. So recognizing this important resource and that it's here with us, we're a part of that community. We want that community to be part of us. And another important reason why nurse practitioners are that particular element that we want to have added to our base here at Codman Square Health Center.
Good morning. My name is Chip Severin. I'm the Chief Medical Officer at Codman Square Health Center. I've had the fortune to have worked in our community for over 25 years. And when I share a little bit about the background that led to the start of the health center back in the 1970s. The health center was started by a group of community activists that were looking to try to support a community who had gone through a lot of change over the previous few decades. There'd been a lot of challenges as the white community moved out of Dorchester and many Black and brown families and immigrants moved into the community. It was a time of struggle and a time that community health centers all over the country were starting to develop. a group of activists came together and decided this is something that would be really, a health center would be really helpful for the community to build an economic engine, to provide healthcare to the community, and to provide civic strength. So it started as a very small health center in the bottom of the former Codman Library in the heart of Codman Square, and over the last 30 plus years has grown into a vibrant community health center serving the health and the well-being of the community in many, many different ways. We're very proud of the work that we do in terms of partnering with other community organizations and building an organization that can help all aspects of life thrive for our patients and other community members. One of the great things about working in community health center is the diversity of the community that you work with. We think at Codman Square Health Center we serve the greatest community of all, and I'm sure that many health centers feel that way, but we really do. The health center serves a largely Black and Brown community. Many folks are immigrants from the Caribbean, including a significant Haitian population. And one of our goals with our providers is to recruit providers that reflect our community, who we think will best serve our community, both in terms of culturally as well as language skills. We're very excited about the start of our nurse practitioner program, which has been extremely successful, not only to build nurse practitioners, which we see as the core of our primary care providers for the future, but also identifying providers, future providers from the community that are Black and Brown, that have language skills, that will really allow us, I think, be successful and really meet the individual and family needs of our community. So this is a great program. We're very invested in our nurse practitioner residency training program, and we're continuing to learn a lot every year about how to build a better organization and partnership with our nurse practitioners.
Welcome to Codman Square Health Center on a rainy, cold February day, but it does get nice here too sometimes. My name's Kyla Biegun. I'm the Nurse Practitioner Residency Director, and this is Codman Square. Come on in. When you first walk into Codman, we have a large waiting room and registration, and where patients get sent to the various areas of the health center. Notably, we also have the resource connector, where patients can go to be linked up with food resources, transportation, housing, legal, immigration resources. Codman really understands that the culture of health impacts patients in many, many ways and attempts to address that. Throughout COVID, I have felt incredibly lucky to work at Codman. They really have prioritized keeping staff and patients safe. Every patient who walks in gets a brand new surgical mask and wears it the entire time they're here. Now, right off of the waiting room, you walk back and we have radiology, urgent care, and the lab. I'll take you in to explore all of it.
Hello, my name is Eileen Boyle. I work in the Radiology Department at Codman Square Health Center, and I want to introduce our brand new digital tomosynthesis mammography machine. So now patients are getting the best and the top quality images at Codman Square. So we're very excited about this. This hopefully will cut back on people having to go for further imaging, and Codman is in the future.
And welcome to our pediatrics department, where FNP residents have a robust rotation to really learn all the ages and age development eye charts. And we also have free books because we recognize that learning to read and spending time with parents at a young age is so powerful for our families.
Hello, our NP students. Welcome to Urgent Care. My name is Donald.
My name is Jeannie.
Just give you an idea of what our rooms look like here. As an NP resident, you will have a robust rotation here with Urgent Care. Okay, this is our rooms. Typically, a patient would come in. We usually would have a seat here, take their vitals, get a bit of a story for you. By the time you come in here, you perhaps might have them get on here to do a more thorough assessment. We have our, some of our basic supplies here, testing supplies and things like that you would need. And of course, the rest of the urgent care staff will always be here and willing to help in any way, shape, or form.
So basically, GC chlamydia done in-house, which is good news because we don't have to send it to Quest. We run it in-house. We do 3 batches per call, like 30 samples per batch. I usually run 2-3 batches a day. Sometimes we do it like one day, one off, one yes, so it depends on the volume. But it's the busiest bench.
What are all the in-house labs that we do here at Codman?
So we have the CBCs, we do like hematology, which include the CBC and CBC occultive, and we do the ASL, which is the POEC, all the PT, we do chemistry, all the basic metabolic, the hepatic, and then we do some TARS, where we have all the immunoassays like villas, hepatitis, Hep C, Hep B, HIV.
So a lot of those labs come back pretty quickly.
Oh yes.
What are some of the labs that we send out to Quest?
To Quest, we have specific testing to Quest. I think they do like the, maybe not to Quest that.
So at Codman, we also have a behavioral health department. This is Patricia Marshall. Patricia, how long have you been at Codman?
Approximately 20 years.
So you've seen our behavioral health department grow and adapt to needs.
Yes.
What are the needs you see currently?
Needs of providing support for people experiencing this COVID and grief support. Children are needing a lot more support because of the social distancing. And we're even thinking about starting some virtual groups. Some people have taken interest in that with depression and anxiety. We have a great team here.
We have a lot of therapists. How many therapists are on staff now?
We have about, I'd say about 12. And we also rotate every year. We have social work interns that are here from places like Simmons, Boston University, trying to think of and other social work schools.
So we have a culture of teaching that crosses
Yes.
between departments.
Yes.
As a primary care, I find it incredibly valuable to be able to put in a referral for behavioral health and know that our patients will be in excellent hands. I also often call the behavioral health department for assistance in urgently triaging acute cases.
Yes. We have been fortunate that we are able to have a somewhat on-the-spot response for urgent needs for patients, as far as if, a primary care provider refers someone, we do have someone on call throughout the day that can reach out to the prospective client, and guide them, whether it be coming here, whether they need to be assessed and have the best team go to their home. But I think that we really overall do a real good team effort to try to get what they need.
Codman also has a lot of group visits, including centering, parenting, hypertension groups, diabetes groups, and weight loss groups. We are working on transitioning those to also be online, in addition to hopefully in person soon. Codman definitely recognizes that when you participate in a group visit, you spend not only more time with your providers, but also more time with your peers. And as a provider who's led a lot of groups, it really feels, it makes my heart sing when a patient swoops in and answers that question in a beautiful way. So it's really rewarding for our providers, but also provides excellent care for our patients. Last but definitely not least, welcome to our family medicine department. This is a family medicine nurse practitioner residency, so come on in, I'll show you around. This is where medical assistants are based. They call patients from the waiting room them in the rooms behind you, and then come back here to get all of the paperwork and computer work done. This is our nurses station, where nurses are based to do all of their computer work, and then also respond to provider requests such as immunizations, teaching, And they all congregate here.
Hello, everybody. This is Sabrina. So this is one of part of the things that we do. I have a stat, as you can see, and I am going to run these labs downstairs after I check to make sure that the orders is in. This is something that we do as NAs. We're glad to have you aboard. We're a team, we're a family, and that's how we work here at Codman.
This is our provider suite where MP residents will have their own dedicated desk, as well as where a lot of precepting actively happens.
Well, welcome to Internal Medicine. I would like to talk to you a little bit about some of the specialty services that we have here. We have HIV services. We also include our case management department. So anyone who is either triaged over here or is identified as HIV positive, we have a robust team of case managers and a nurse case manager as well that will take care of all of their needs. We also have our X clinic, which is our STD clinic here. And we provide all of our testing and treatment services for patients who are exposed or who are referred by patient services, as well as persons who are interested in long-acting reversible contraceptives. We offer same-day prep services and an array of services for the LGBTQIA+ population. This is our safe space. We want to make sure that everyone who comes in here is welcome and treated in a way that provides them with dignity and respect. We also have a substance use department here as well, and we refer patients back and forth for persons who exchange needles, for persons who inject drugs. We have syringe services, I believe, and we also work with persons who are identified as Hep C through our X clinic and refer them over to our SEDS team.
And NP residents have robust rotations in both the X clinic and the substance use clinic, and both those clinics are really spearheaded by nurse practitioners. Below the big beautiful health center we just toured upstairs is Codman Academy Charter School, housed in the same building, is 9 through 12, and across the street is K through 8. Codman really recognizes that health starts in our youth and with education. So this is the Great Hall, the old Codman Square Library, where our health center was founded. Today, Codman recognizes that health is more than just medicine. Today, this space is used for community gatherings for anyone in the community who needs it for various reasons. Thank you for taking a tour of our health center, including group medical visits, pharmacy, optical shop, health insurance help, community-focused food, urgent care, family medicine, dental, pediatric, eye care, internal medicine, behavioral health, and then also recognizing that health is more than medicine. Right down the road from Codman, we have both the Daily Table, a teaching kitchen, and HealthWorks Community Fitness. Welcome to the Daily Table, established in 2012. There's now a Daily Table in Dorchester, Roxbury, and one opening in Cambridge. You can use food stamps on anything here. There is a lot of pre-made food, and the idea is that people can get a healthy meal for the same price point as fast food. And so Codman really recognizes that health starts with food and health starts with our community. Welcome to HealthWorks Community Fitness. We are affiliated with them at Codman. A provider can actually write a prescription that gets a patient 3 free months here at this wonderful gym for women and children. They have awesome machines as well as multiple classes like Zumba, yoga, African dance, and it's a really good way to bring the health of the community in with our health center.
Hi, my name is Nnemdi Azubuko. I'm one of the NP residents at Codman Square Health Center. I wanted to do a residency because I feel like primary care is so broad, and I knew a residency would be a great way for me to take everything I've been learning in school and just apply it at a pace that felt more comfortable for me. You hear the horror stories about people jumping straight into work and they're seeing like 10 patients at a time. And I personally did not want that to be me. And so it's a huge learning curve coming from clinical to the working world. And I just wanted to be able to make that transition in an environment that was basically designed for me to do that, and just help me through this tough transitional period, and give me the opportunity to learn more from different providers, and just build on the knowledge that I already had coming into this residency. And I specifically wanted to work at Codman because it is a community health center, and that's one of the reasons that I wanted to go into nursing in the first place. I grew up in Dorchester, and so I grew up around these different health centers like Dot House, Codman Square, Dimmick, and places like that. And just growing up in Dorchester, I wanted to serve the community that I was a part of, that I am a part of. And part of that goes into the fact that a large portion of our patients are people of color, and I wanted to serve my community as a provider of color. Many of the patients that we do see here are Caribbean, and both of my parents are immigrants from Nigeria, and so there's so many cultural similarities, and I feel like that's been really helpful for me to connect with my patients. And a large portion of our patients are Haitian Creole or French speaking, and so it's been kind of interesting navigating that language barrier. And thankfully, we have phone interpreters that we have access to, and so that's made things a lot easier, and taught me that I need to work on my Haitian Creole. And then another thing that I really like about Codman is the range of providers that we get to work with through this residency. So at Codman, a lot of the providers, we have doctors and Ps and PAs, and I think that the preceptors we get to work with, we have a pretty equal mix of those. And so it's been really great to learn from everybody. Everybody's like really great providers, and it's awesome that we just get to be here and learn and soak up all the knowledge that they have. And a typical day at Codman for me is depending on the day. So we have morning session. I usually come in early. I don't like to stay late. And so I arrive about an hour to 30 minutes before my morning session starts. And that way I can catch up on notes from the previous day if I have any, and to prep for the patients that I'm going to be seeing in the session coming up. Each session is about 4 hours. And so in that time frame, so it's been about 3 months now. And so we are up to about 4 to 5 patients a session. And so I just look up those patients, and then I head down to whatever department I'm in for the day. Usually we're in family medicine, but depending on the space and other things that are above my head, we can be in internal medicine or something like that. And then I just check the board, and that lets me know which MA I'm going to be working with. And then we have a quick huddle. I give them a little rundown of what I'm expecting from the patients. Sometimes it's a surprise, and then we both get to find out why the patient's coming in. And then after that, we start seeing patients that come in. And then some days we have specialty clinics or internships when we work with another provider and we work off of their patient list. And I think that's really great because it gives us an opportunity to see what it's like what primary care looks like, especially since a lot of our preceptors have been doing this for a little while now, to see the relationship that they've developed with their patients, I think is really great. And just learning all the different aspects of primary care from different people. And I think we're just really lucky to be able to have that perspective.
So hi, my name is Marta. I'm a nurse practitioner resident at Codman Square Health Center. I chose to do an NP residency because even though I felt my NP program was fairly strong, I thought that I had some gaps in my clinical knowledge, and I felt that I didn't experience a lot of things in my clinical year. And so I wanted to transition from my RN into my NP role in a place that was supportive of learning and that had preceptors that were sort of experienced in being with learners and teaching. I was hoping also to have more comprehensive training so that I would come out of my first year in practice a little bit more well-rounded in primary care, seeing patients of all ages. I chose Codman because even though it was the first year doing a residency, I was aware that they had a medical residency and that they have a lot of different types of learners that go through Codman Square. So I felt that it was going to be a good place for learning, and they had some structures set up to allow learning to be very successful. It was also very important for me to be in a community health center and to be in a medical home. I also wanted to do my residency in Boston, where I've been living for a long time, because it is home and I wanted to be caring for patients here. I also had heard about Codman throughout my years working as a nurse and knew it was a good place to work, so I was excited to end up here. So I absolutely love my patients at Codman Square. We have quite a diverse population, and I would say that our patients are mostly Black with Afro-Caribbean backgrounds. I have a lot of patients that speak Haitian Creole, and then we are seeing an increasing amount of Spanish-speaking patients. And there's also a bunch of other languages. Like I just saw a patient who spoke Bengali last week. So kind of a very diverse population. Throughout the day, I'm working very closely with the medical assistants and very, very, very closely with my preceptors, whoever is precepting us for the session. And preceptors are other nurse practitioners, physician's assistants, or medical doctors. So it's been really great to sort of get a different variety of perspectives on how to do things. And we do get to precept with different specialties as well that we are very lucky to have at Codman. So from podiatry to gynecology to the substance use disorder treatment team. So you also are working very closely with the nurses, which is great. They're a great team here. And then other staff that you do interact on a daily basis is also the patient representatives, case managers, nutritionists, and our behavioral health staff. Every day in the life of an NP resident is a little bit different. There's days where you might have a clinical session, so 4 hours seeing patients back to back. And so on those days, I kind of go in, I do some pre-work on my patients, and then you're seeing patients and working with the medical assistant, the nurses, and the preceptor, working with those patients. We try to get as many notes done before, during, and after each session, kind of replying to patient messages, calling with lab results, sending refills, things like that. And then while you have those sessions that you're managing your patients and they're on your schedule, we will have other sessions where we're seeing patients off of a different provider schedule. So often those are the specialties, like the gynecologist or our X clinic, which usually is doing like seeing patients who are coming in for sexually transmitted infection screening or testing and treatment. So those are you'll be working off of the provider schedule and working very closely with them. Other than that, there's other days of the week where we might have a training or didactics for the afternoon and sort of other things as they come up. So I'd say at this point I've been at Codman for a few months, and kind of looking back on it, I've been very happy to have chosen to do an NP residency and to end up at Codman. There's been an incredible amount of support poured into the residency and to us, and everyone has been incredibly welcome. Our patients are absolutely amazing. They're a privilege to work with. They've also been incredibly welcoming and so patient, and we've learned a lot from them so far. And I'd say also something that's been really nice about the residency is that they've really worked with us to try to understand what our interests are and what our goals are, and really getting us as much of those experiences that we want as much as possible. So it's been really, really great.
Hi, my name's Denise, and I'm a certified addictions nurse practitioner at Codman Square Health Center. And I chose to precept because I love to teach, and I love to teach people about substance use treatment. And it's been a wonderful experience having nurse practitioner residents spend time learning about caring for patients with substance use disorders.
Hello, my name is Yasmin Verdieu. I am one of the preceptors. Here at Codman, we have a very robust nurse practitioner program, and the learning experience is unparalleled. The preceptors are remarkable. There's a lot to see and a lot to learn. And if this is what you are looking for, Codman is the place to be.
I precept out of an appreciation for all those who have and continue to still mentor and teach me. And because teaching truly is the best form of learning, it brings me joy to precept because I learn just as much from the trainees as they do from me as we work through different case studies and questions together.
Hi, everyone. My name is Iris Montijo. I'm one of the pediatric and adolescent nurse practitioners here at Codman Square Health Center. I have been here about 6 years. And for me, mentoring is truly a blessing, as is an opportunity to inspire, motivate, and learn. And this relationship is actually bidirectional, because as much as I get an opportunity to teach, I'm also blessed to learn from my students, and my students always push me to excel and become a better teacher. Being a mentor also provides me with an opportunity to help develop the next generation of nurse practitioners. And as a mentor and a leader, another's success is also my success. Someone else once mentored me. So mentoring is another way of me giving back to the profession. And I look forward to continuing to mentor and learn from all of you.
So I love precepting for a few reasons, but a big reason is that I really want to give back. So I really credit a lot of my being really ready to practice to having amazing folks who mentored me and precepted me when I was becoming an NP. So I am really excited about helping to train NPs who are confident and really ready for practice. But I also think that I learn a lot by having the NP residents, especially the ones we have right now, just so intelligent, have such wonderful life perspective. And as we kind of confront new challenges, I am forced to really figure out more things that I can learn. So I love precepting, and this has been a great program. Thank you.
I think that the joy of precepting is really bringing the student into a place where they can have the skills and resources to effectively manage some of the the incredible diversity of patients with incredibly complex medical problems in the spirit of being a strong community advocate and one that will ultimately result in improving the general care of the community as a result. So I think that's being part of that process is a wonderful thing. And the elements of education and being there to see the growth of a person as they go through the cycles of being a bit unfamiliar and a bit fumbling in their first attempts, and then seeing them come out as a really crisp, competent, enlightened, and effective provider is a wonderful transition to watch. So it's a cool thing.